whatever the government determines your health care is going to be, that's what's going to be required. And none of us are government agents. We are self-regulated, and we want to individualize care to the best of our ability.
On November 9th, close to 60 medical professionals, many of whom were BC doctors, were inside of the BC legislature because they want the province's new Health Act to be repealed. In this report, you're going to hear some of their concerns about the new Health Profession Occupation Act and why every British Columbian should be concerned. Drea Humphrey here with Rebel News at the BC Legislature. And before I get into the report and you hear these concerns, I just want to let you know that I had to take the ferry and we are independent media. And so what that means is we can't bring you reports like this without your support. So anytime you want to chip in a few bucks to help us, or you want to help me recoup the costs that it took to get here, you can go to rebelfieldreports.com, and that really does help us out. Now, in case you don't know, the Health Professions Occupation Act was formerly called Bill 36, and I did many reports. This act could lead to doctors, psychiatrists, nurses, you name it, being forced to relinquish patients' files without their permission to the government. It seeks to take the now 15 regulatory bodies that govern such industries and take it down into just 6 that will get a new appointed board of directors and will be overseen by the government instead of necessarily being overseen by their peers. And so, in short, many of these healthcare professionals are concerned that it's going to give the government sweeping powers over how they advocate or can't advocate for their patients. Now, I'm going to let the healthcare professionals talk to you that met today after 5,000 postcards against this bill calling for MLAs to repeal it were hand-delivered to the leader of the Conservative Party of BC, John Rusted, who then presented them in the House.
The difference that we can honor them, that they can carry on with their profession, and that the support will be there so that they'll be able to carry on a day-to-day basis doing what it is that they're being trained to do, which is provide us the best health care possible in this province. Our healthcare system needs dramatic change, ladies and gentlemen, and you're all a part of that in coming out here and doing this today, talking about this. I look forward to that work ahead, and I look forward to unveiling what we're going to be doing as a Conservative Party of British Columbia to change healthcare for the better in this province. Thanks everybody again for coming out here today.
So, Dr. Kime, you were one of the speakers here today, and you came out of the gallery. Why was it important to be here today?
Well, it's important primarily. A physician is a teacher. We teach our patients, we teach them about life, we teach them about health care. And if I am not able to have meaningful discussions with an individual patient sitting in front of me, free from any mandate or any exterior force, I need to be able to have a conversation to meet their needs. This is what this HPOA Act that was talked about in the Parliament or in the legislature today is something that will restrict my ability to talk with my patients freely, because boards and regulators and bureaucrats are now going to define what is information and what is misinformation. And to have bureaucrats who have no medical expertise mandate what is acceptable and what is not acceptable is clearly a politicization of medicine, and that's inappropriate.
Speaking of...
So this is, and Minister Dis is saying this bill is making us safer, right? So government does not belong, or politicians do not belong in medicine, okay? In nowhere does the Health Profession Act do they get input from frontline workers. So it actually makes us less safe.
This is Dr. Saporznikov. Now, tell us a little bit about why you're so concerned about this Health Act.
I'm concerned about the Health Act because I unfortunately can see very clear parallels from my previous life in the Soviet Union, and where we were afraid to ask questions, and we were not allowed to have any debate, and we pretty much had no freedom to advocate for ourselves or our patients. And this concern started very clearly in since the start of the COVID. When I start talking about the medications that I have been using for my whole life, all of a sudden that medications are not supposed to be used, or all of a sudden they become dangerous, I started seeing some inconsistencies. And this inconsistency started concerning me very, very much. And from there, things just got worse. And unfortunately, at this point, because I decided not to get vaccinated, because I decided that the risk of getting COVID or getting complications for COVID is very low for me, I had to face consequences which actually left me shocked. I never expected any kind of medical treatment to be mandated. I never heard of it. It's the first time in my close to 40 years of professional life.
It's easy to see the problems with the HPOA. Maybe a little bit more difficult to identify solutions. But here's one to start with. Let's hire back our heroes. Right, that's pretty simple. There's been we heard today, bigger numbers than I thought, but close to 10,000 people have either early retirement, left, relocated, got a new job. Those people would all come back and they're ready to work. Simple solution.
All right, this is Dr. Stephen Malthouse, a familiar face on Rebel News. You've got a wealth of experience practicing in family, palliative care, and you've really stood up for freedoms in healthcare over the last few years. What in particular do you find so egregious about this particular act?
Well, this act is going to speed up the deterioration of healthcare in the province here. Well, what this act does, which was passed about a year ago now, the Health Professions and Occupations Act, is that it actually gives control of all of healthcare pretty much into the hands of politicians. In other words, a politician will be able to tell a doctor what he or she can tell their patients. And if they don't do that, if they decide to tell the patients what more may individually fit them and what the doctor feels is more appropriate, then they could be held to pay fines of up to $500,000 and be in prison for 2 years. Now, nobody in their right mind is going to come and work in a province where they have that kind of a threat hanging over them. Furthermore, the Act allows the government to go in and seize records and distribute them among anyone they think is necessary to take part in assessing a practice. They're able to close doctors' doors, lock them out of their practice immediately on having an anonymous complaint. What we're seeing is that doctors are being put in a position where they are really becoming agents of the government. They won't be able to tell their patients what they feel is the truth about their condition.
And as we get close to Remembrance Day, we've heard consistently people talking about our military who have given so much to serve and protect us. Well, in the health profession, that's what we want to do too. We want to serve and protect. We can't serve without healthcare workers. And so protect. The government says this new Health Professions Occupation Act protects the public. Protects them from what? They consider us as offenders, every one of us. And so the public has to be protected.
What to you stands out the most as the most egregious thing about this act?
I think the most egregious thing is the fact that it has taken away individual care, that now it is essentially asking healthcare providers who have the knowledge and experience and will listen to individual patients and their situations. Now it's a one-size-fits-all. Whatever the government determines your health care is going to be, that's what's going to be required. And none of us are government agents. We are self-regulated, and we want to individualize care to the best of our ability.
Well, Minister Dix has told us that this act is going to make public health safer. Nothing could be further from the truth. It's going to make it much less safe for the people of British Columbia. They need to have a choice in their health care. Whatever that is, they need to have autonomy, and they need their physicians to be able to advise them as they see fit. We're well trained. We take an oath to serve and to protect the people of British Columbia, and we take that seriously, and we won't stand to have government tell us how to treat our patients.
Speaking of politics in the House, we heard the health minister say, hey, this has been heavily consulted. Many people have had their hands on it, Indigenous communities, healthcare workers. What do you make of that?
Well, obviously I wasn't involved, so I don't know, but it's easy to say things. And we heard from one of the speakers of how there were 56 responses in a survey to the doctors of British Columbia, many thousands of doctors. So out of 56 responses, I don't know how many doctors, 7,000 probably, it's probably more, 10,000. Then you have 56 responses of that. How is that meaningful consultation?
What surprises me, because I speak with those medical professionals that are still, up until now, have no idea what Bill 36 is and whether Bill 36 exists at all, because when I ask them, did you hear about it? They say, no, I never heard about it. So I don't know who those medical professionals are that he consulted with, but it's definitely not anybody that I know.
Well, I find that difficult to believe. And I've worked in all 3 hospitals on southern Vancouver Island. Every time I became aware of Bill 36 fairly early, and asking all of my colleagues, most of them had never heard of it. They'd never been informed by their college. They were only told about it randomly.
I don't know where he says that, where he gets the evidence for that, to tell you the truth. He talks about how they consulted 4,000 people, but in fact, when they sent out a survey, which was very generally written and was presented to doctors just before the Christmas holidays a couple of years ago, they only had 56 replies from doctors. So I don't think 56 people responding to that survey is what you call a good consultation. I think that when we ask people on the street, do you know that you're going to lose your doctor because the doctor is going to be held responsible to just pretty much say what the government tells them to say, that they would find any of those people agree with the government. This has not been a consultation which has included the public, the doctors, the nurses, the chiropractors, the dentists, the pharmacists, the optometrists, everybody who's going to be essentially put under the control of this new act. And I think that's a very irresponsible thing for him to say.
This business about consulting the healthcare industry or professionals is nonsense. We know, in fact, that didn't happen. The consultation process was blown over and inflated terribly. He's misrepresenting it. It's not true. And if you go through a hospital like a new friend I made here, Dr. Anna, she said her colleagues in the hospital haven't even heard of Bill 36. They're asking her, what is this? What is it? What's it about? It's tragic. This was shoveled through in the late hours. They didn't even read the entire bill in the House, I was told.
They didn't debate at all.
No, that's what I understand, and that's wrong.
At Rebel News, we get our boots on the ground to bring you the other side of important stories. If you appreciate that, please go to rebelfieldreports.com and donate what you can.